Good morning. This year our idea of normal has been turned upside down. For nearly a quarter of a year, we've spent time in our homes with little interaction with family members other than our household, little interaction with our coworkers or our friends. And this social interaction is an important part of who we are, and it's been sidelined. The fear of a new virus, the anxiety of a wobbly economy, canceling milestones such as weddings, graduations, or reunions has all left us out of sync. Changing our lifestyle, worrying about the virus affecting ourselves or our loved ones who might be more vulnerable has certainly taken its toll on us. Adapting to these lifestyle changes is layered and intertwined with the pandemic. And this is also mixed in with a new civil rights movement that has flooded our streets. Systemic racism is thriving in America, and the death of George Floyd has left the country enraged. This has displayed a shameful chapter in the history of America, and a historic chapter of our past, but also, sadly, our present. To see thousands take the streets, black and white families marching side by side, gives us promise and hope. A hope that perhaps the death of George Floyd was not in vain. It shows that maybe the death of Mr. Floyd may be a turning point in our country, where black lives do matter to everyone, and the disparities that we all know about in healthcare and in housing, in education, and in the workplace may be finally coming to an end. Skin color is a part of who we are, but our skin also holds the rest of us, our brain and our hearts. And these are powerful forces for good, but they can also tear us apart. And all of the uncertainty that we're living through now, the year that we could have not possibly have imagined, has left us with stressors, new stressors to bear. Anxiety and unrest can weigh heavily upon us, on all of us, and that's bearing out. In April, the Substance Abuse and Mental Health Administration reported an increase in text messages to their helpline of 1,000%. A Yale University study in April of 5,000 teachers asked them about their emotions, and their top 5 reported emotions were anxious, fearful, worried, overwhelmed, and sad. A recent University of Oregon study of caregivers reported a 68% increase in stress. And at a time when things might feel bleak, it's important to focus on your mental health, as well as checking on your friends and your loved ones. Feeling overwhelmed and out of sync is certainly understandable, but it's also recommended and encouraged to ask for help. And there's a new resource available in St. Louis, a new resource for those who want to see a mental health professional. The United Way of Greater St. Louis, along with the St. Louis Mental Health Board, has put together a program that provides help only a few seconds away. Today, I'm joined by Serena Muhammad, the director of the St. Louis Mental Health Board, to give us details about this program and help us understand why, if you're feeling a little bit out of sync, it's important to reach out and to ask for help. Serena?
Thank you, Dr. Page. So I want to clarify, I'm the Director of Strategic Initiatives for the St. Louis Mental Health Board, and I want to talk about a resource that we have in partnership with United Way 211 and Behavioral Health Response of Greater St. Louis. Many people in the St. Louis area and around the country may be experiencing emotional strain due to the pandemic, due to the civil unrest. These are very trying and uncertain times. It's normal to feel stressed. It's normal to feel anxious, depressed, or even grief. We understand that with these emotions, there is a need to try to regulate and to try to get back to what feels normal and comfortable for you. We recommend that if you are struggling with emotions that you are not able to manage, that you call 211. You don't have to be in crisis. If you call 211 and press 1, you will be connected to a behavioral health professional who can help you resolve whatever you're experiencing. If you need long-term support, they can connect you to a therapist, and you can get long-term support over the course of whatever it is that you're dealing with. So keep in mind that this is new for many of us. Many people have never experienced a mental illness or any symptoms of mental illness, so you may not recognize what's going on. Don't try to diagnose yourself. If you're not feeling like yourself, call 211, press 1, and someone there will be able to assist you. We also have a special number for youth who would prefer to text instead of call. For our youth, text line is the letter B, the word HEARD, so that's BHEARD, and you text that to 31658. So that's our youth helpline. And these resources are supported by the St. Louis Mental Health Board, as well as the St. Louis County Children's Service Fund. So it's available to city and county residents. The last thing that I just want to note is in the St. Louis region, we have been keeping track of the call volume, just to give people an idea of how prevalent this is, so that you don't feel isolated or that there is something unique that is happening to you and is not happening to others. There has been an increase of about 20% in call volume for the behavioral health response line. What that translates to is for the entire year of 2019, the 211 system received about 1,400 calls from mental health services. To date, in the past 6 months, that has been tripled, close to 3,500. So people are using the resource for lots of reasons. And one benefit of connecting 211 with BHR is that 211 also has social service supports. So we encourage you to call to get any help that you may need. Any questions?
Any questions?
You said it was 20% increase in the behavioral health line, or what is that for United Way, or what are you talking about there?
So you dial 211 and you press 1 and it connects you to behavioral health response. Behavioral health response is a separate agency that focuses on counseling and mental health services.
But the numbers you gave out, is that for that agency, or what are those from?
That's for that agency. That's for people who call 211 and press 1. This time last year, there were about 1,400 behavioral health calls. For this time this year, it's about 3,400.
To that behavioral health line.
So when you press 211 and dial 1, it connects you to behavioral health. So those were calls where somebody called in and said, I have a behavioral health concern, and they were connected to BHR.
Dr. Chris, can I ask you just, what about this is important in your mind, or for either one of you? What about this is significant? Perhaps you could both speak to it. You've been close to this. What about this is important?
Well, I think we have to understand that this is one of the most dramatic changes in our lifestyle and how we manage ourselves, how we get around in our community. This has impacted our economy. This has impacted our health. This is a serious threat to our health, a global pandemic, and that injects a great deal of stress in our lives, stress and worry and fear, and we have to navigate this, we have to manage it, and it's appropriate. It's appropriate to feel that stress. It's normal to feel that stress. It's normal to feel those emotions, and there are people out there to help with that. And some folks may not have seen a mental health professional in the past. They may not have access to one now because of some change in their life. And this is as simple as calling 211 and pressing 1 and asking to talk to somebody. If you need more care, they can certainly manage that and triage that and get you to the right person. And sometimes the mental health professionals that are available on the phone can help you through whatever you're dealing with right now.
So this is not a new program. This has always been there. You're just saying, hey, it's out there in case
It's out there. It has more resources. You want to ask?
Right.
Ms. Beth?
I will add the element that's new is that behavioral health response has always had its own 10-digit phone number. We thought that it would simplify things if it was connected to 211. So the ability to dial 211 and press 1 is the enhancement, and it's easier for people to remember. And because it's connected to the United Way, you also have the opportunity to connect to other resources. So what we find is that people are calling because they've lost employment, Their housing is unstable. There are other issues that they're dealing with as well. So in one phone call, they can get all of that addressed instead of having to call 2 separate lines.
Dr. Miz, can you also speak to your reaction, response to the situation in Florissant with this detective and the situation with the video showing him effecting this arrest? Concerning to you, what's your reaction, response? Where do you stand on this?
I think we're going to see, cell phone videos are everywhere, and they're going to be, and our law enforcement now, universally, at least in our region, have cameras. And I think we're going to be seeing a lot of cameras about law enforcement and citizen interactions, a lot of video to review, and that'll drive the conversation. And we're in the middle of reviewing all of our policy across the country. You can hear about law enforcement and how they interact with our citizens. And this video certainly is alarming. And I believe that the Florissant Police Department will manage it appropriately. They'll investigate the details around there, and we'll learn more in the coming days and weeks.
Dr. Page, speaking of that interaction with people and police, we're seeing a lot of different departments kind of changing their ways when it comes to looking at police brutality. Minneapolis, basically defunding their police department. Kansas City kind of shifting the way that their police department handles investigations within itself. What could happen here in the county with the police department as far as, are you all talking about ways of shifting, kind of what's happening right now?
Well, I think we started this conversation about equity and inclusion really in our police department about 6 months ago, and we already started initiating review and reform. We replaced our entire police board. The Center for Equity and Policing is currently working with our police board to review their policies and procedures. So we started this conversation really several months ago, and it will continue. And we will, I do believe that St. Louis County has a very good police department. We certainly had our challenges historically. We accept that as part of our history, and we're going to always be looking for ways to improve the way we deliver our services. Any other questions? Doug, anything? Okay, thank you.
The behavioral health responses of the county, is that a private agency?